Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Welcome to another episode of Muslims and Mental Health. October is a month with a lot of different days of awareness, and one of those days is the Pregnancy and Infant Loss Awareness Day, and that's October 15th. So we're going to be discussing why this day came about today and what you need to know about it and how it can be helpful to you. So to begin with, this day is observed in the United States, in Canada, in the United Kingdom, and Australia, and it was created in 1988. The movement started in 1987, but it was created in 1988 by President Ronald Reagan. And it was set aside to remember pregnancy loss and infant death, which includes, and it's not limited to, but it includes things like miscarriage, stillbirth, sudden infant death syndrome, or SIDS, or the death of a newborn. And so this day was set aside because approximately each year, 1 million pregnancies in the United States end in miscarriage, stillbirth, or the death of a newborn child. And so it gives us an opportunity to increase our understanding of the great tragedy that's involved in these deaths and of the unborn and the newborn babies. It also enables us to consider how, as individuals and communities, we can meet the needs of bereaved parents and family members and help them work on to prevent causes of these problems and their grief through these issues. So I want to circle back and talk about President Reagan. How was President Reagan involved? Well, President Reagan, issued the order making this a National Awareness Day. And the reason he was cited as saying, when a child loses his parent, they are called an orphan. When a spouse loses her or his partner, they are called a widow or a widower. When parents lose their child, there isn't a word to describe them. And this is often what we see. People either don't know how to understand a loss of a pregnancy or a child, or they often dismiss it as if, well, it wasn't really a child, so, you don't need to be grieving. When in point of fact, there is a lot of grief that surrounds miscarriages and lost children. And what most people don't realize is that the pain is just as real for the parents of these pregnancies and children because they miss the opportunity to hold their baby. For some people, after having experienced a miscarriage, it's very difficult for them to even try again. There's a lot of fear in what may happen, and they are afraid to go through it again, and they're confounded as to why it happened in the first place. And so there is a lot of grief that is unexplored, typically around the issue of losing an infant or a pregnancy. What parents can do after the loss of a pregnancy or a child, if you're one of these people who have suffered one of these things, you can stay positive. That would be the first thing, to try to stay positive. At least half of the women in our country have experienced, will or have had an experience of a miscarriage in their lifetime. So you're not alone. And it's important to take one day at a time and just, stay positive and celebrate, the completion of each week as you're getting through it. Take good care of yourself. What does that look like? Well, focus on your physical well-being, your sleep, your nutrition, your physical activity, your ability to deal with stress as you move forward. How can you make those better so that you can have a better pregnancy next time if you want to try again? And how much stress do you have in your life? Evaluate that, because too much stress, as we will be discussing in an upcoming episode, too much stress on the fetus can even cause mental illness in the womb. And so it's both affects mother and child, and it's really important to pay attention to your levels of stress because that can jeopardize your pregnancy. Also do your homework if that helps. So in preparation of moving forward, find out if you had, for example, endometriosis, or you had an incompetent cervix or a blighted ovum or something, some reason why you are prone or have a tendency maybe to have a miscarriage, do your homework and find out why that might be, what you can do to prevent it moving forward, how you can best prepare for it so that you have more awareness, more education, more preparation, and hopefully for a better outcome the next time around. Again, know that you're not alone. As I mentioned before, half of the women in the United States have experienced or will experience a miscarriage. And so there are many women out there who can relate to your experience, who can be there to help you. Your family and friends can help you get through this time period. And communicate with your partner and your family. It's really important here to recognize and acknowledge and be respectful of everyone's differences in the way they process grief. So, for example, and this is a real generalization, so it doesn't necessarily specifically apply to any one person, but generally speaking, women like to talk about their grief or the issues that are going on with them, whereas men typically have a different response to this type of grief, and they really don't want to talk about it. And the more you talk about it, the more they actually re-experience the loss or the grief that they're feeling. So just, check it out with each other, what works best for you, and be respectful of each other and try to help each other in the way that best helps that person. So if it's talking about it, allowing the person to talk. If it's not talking about it, allowing that person the space not to hear about it. And your family can be really helpful in this regard. So if you're a woman and you need to talk about it, but your husband really doesn't want to hear about it, then, you have your mother or your father or your sisters, your brothers, other people in your family that can actually help you go through the grief. Oftentimes, unfortunately, we don't communicate enough about what is going on with us, and so our extended family members are not aware of the help that we need. So, more reaching out, more talking about what you actually need to help you get through this process can be quite helpful and can be quite cathartic. Also, talk to your doctor or your midwife or your doula, whoever you rely upon for your birthing needs. Make sure you continue to talk to them and talk to them often about your thoughts about moving forward. If you want to try again, what you should be doing to make that a better experience, and what advice they give you in terms of your overall health and when you should consider trying again, because for everybody that's different, and the doctors will have different advice for you about what is best recommended for you. And maybe if you had a midwife or a doula before and you want to consider a doctor this time or vice versa, all those things are important to consider and to talk with them about, and often. Also, you can find a support group all around the country, and we will actually have a list on nefshealertherapy.wordpress.com for you to refer to that of the support groups around the country that support infant and child loss or pregnancy loss. There are support groups in every state around the country. And again, we'll have a list of that on nefshealertherapy.wordpress.com. Oftentimes, groups like that can help you process what you're feeling, process your grief, because most of the people involved with them have had a similar experience or have had the experience of losing a child or a pregnancy, and will be able to relate to you. And sometimes finding that commonality can be very relieving to know that you're not the only one. Again, that you're not alone. And people can often in those groups have tips that they can share with you to make your experience moving forward much better. And then lastly, if you find that none of those things are working for you, you certainly can seek professional help. We have many therapists who are trained in helping women with pregnancy and with the loss of children or the loss of a pregnancy. In fact, there are more and more therapists who are getting specifically trained for that type of grief. And so that exists. It's out there for your service, and you just need to seek it out. Other ways that people can help. So the people who are family members or friends of people who have lost a pregnancy or a child, there are ways in which you can help as well. These are collected from people who have gone through this experience and given their feedback about what they felt would have been more helpful around the time that they were experiencing their grief. So I'm going to share some of those with you now. One of them is that people find it really comforting when other people tell them that they are in their prayers. And even in Islam, we know that when a person loses a child and they've lost more than one child, these children that they've lost become a bridge to the Jannah, to the heaven, for the mothers and the parents who have lost these children. So even though they have gone, there is still a connection, and there's still a benefit of having experienced this opportunity to bring a life into the world and have a child. So we know that this is something that is taken very seriously in Islam, and it's something that has a connection both in the dunya and in the here and now, and also in the hereafter. Additionally, friends and family can cook for the family. That's another thing that you can do, because oftentimes people are distracted and they don't really have the will, if you will, to cook or to do those type of household activities. So along with the cooking, you could offer to clean, you could offer to do laundry, visiting them, visiting the people who have suffered the loss. A lot of times people think, well, maybe we should just stay away from them for a minute and let them, settle. But oftentimes it's much better to visit them. And we know as Muslims, we are actually encouraged to visit the sick. So, I would frame it that way as well. Like, these are people that actually could use a visitor. Let people know you were also affected by the death. So it helps people sometimes to know that they're not the only ones suffering from this death, that you too were affected by it. That sometimes can give relief to people who are grieving. You can run errands for them. You can offer to take the children, if they have other children other than the one that they lost. Typically, those children are also experiencing grief themselves, and it goes really overlooked and sometimes dismissed because they're children. So they also need an outlet. And one of the ways you can help the parents or the family is to offer to take the children out to a movie or putt-putt or something positive and productive for the children, so that they're not sitting around with their grief and not doing anything or not processing it in any way. You can also offer a shoulder to cry on. Many times people don't know who they can turn to express their grief. So if you're a friend or a family member, you can just tell them, look, I'm here for you. I'm a shoulder to cry on. If you need someone to talk to, I'm here for you. There's also, in recent years, there's been an interesting opportunity, which people have given feedback that they enjoy, which is that you can give a certificate of planting a tree. So it's a way of sort of remembering the loss by creating new life, not in the form of a human being, but as in planting a tree. And so it's something that you would buy and you would give to the families grieving. It's just a certificate saying that we planted a tree in honor of the lost pregnancy or the infant that has passed away. And sometimes this can be comforting as well. Gift baskets, of course, flowers, these things we typically know that people give in times of grief or loss can also be helpful. So other things to consider is that, again, do people want to wait and try again? Well, it's really important to consider this a very personal decision and consult with your physician and see what works best for you. All of these decisions need to be made in consultation with your physician or your doula or your midwife. And again, I want to mention that we have a list of supports on nefshealertherapy.wordpress.com. And we hope that you will take time on October 15th and consider the people who have lost pregnancies and who have lost infants, and remember them that day. If you Google Pregnancy and Infant Loss Awareness Day, you will find around the country, and again, like in Canada, the UK, Australia, that they will be having candle lighting ceremonies. If that's something that you want to participate in, they have many websites which will tell you the venues where they're doing these candle lighting ceremonies. But that's typically what you see with different organizations who participate in this. They will be lighting candles on that day. And take time to remember people who have lost pregnancies that you know of and who have lost children, and tell them, that you care. So thank you. This concludes another episode of Muslims and Mental Health. We look forward to your feedback, your comments, your concerns. You can give them to us at nefshealertherapy@gmail.com. That's NAFSHEALER therapy@gmail.com. And again, you'll find resources at our website, nefshealertherapy.wordpress.com. Thank you.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.